Good afternoon, everybody. Thank you for being here. No new deaths in the community over the last 24 hours. Unfortunately, over the weekend, we did lose 2 members of our community to the COVID-19 pandemic. We've now lost 207 of our neighbors directly related to COVID. So the 2 members of our community over the weekend both had underlying health conditions. That's what we've seen with this virus. Is a deadly virus. It preys on those who have pre-existing and underlying medical conditions, and so certainly that's part of what this process is about, making sure that we're vigilant in our efforts to do what works. So, saying that, looking at testing. Over the last 24 hours, we've received back 1,263 diagnostic tests. Our 7-day rolling average for diagnostic testing only, that's the nasal swab, is 0.97. In addition to these tests, our local colleges, our NBT Bank Stadium testing, we've performed 6,484 pooled saliva tests over the last 7 days. When you add up the pooled tests and the diagnostic tests, our 7-day average drops to 0.67. Why do we add them both up? Because we get positives from both of them, so we got to count the negatives that you get from both of them as well. So 0.67, good rate. Certainly other parts of the state now are seeing upticks in the Hudson Valley, New York City area. It's just a reminder, the virus it's still here, it's going to be here. If we continue to be smart, we'll continue to be able to regain access to our way of living while we buy time for the medical community to come up with a treatment and a vaccine. But the concept that we can be too loose with our behavior and that this virus won't bite us is just not a concept that's going to work. So people need to remain aware of your surroundings, wear a mask, distance when appropriate, and just be smart. You know the circles of people you've been with over the pandemic, and you know what they're doing on a daily basis. We can't get too ahead of ourselves here and have the data go the opposite way. We're doing everything we can to get the economy open fully. We've taken a data-driven approach. If the data goes the wrong way, we won't be able to. We know that. We've learned that from our partners in the state. Looking at hospitalizations, 12 individuals are hospitalized. No one is in the ICU at this time. Out of those in the hospital, 10 Caucasian, 2 African American. Overall, as far as cases go, we've had 4,172 positive cases. That's up 12 since yesterday. Of the 12 cases, 2 are travel-related from the state of Ohio and Pennsylvania. 2 are household contacts. Again, a household contact being somebody that lives with someone or rooms with somebody who became COVID positive. We know that these are going to happen. It's hard in many living situations to completely isolate, and so this is part of the process. One case is still being traced. 7 are community spread, of which we know the source of 4 of them. Active cases at 198, that's down 12 since yesterday. We've had 3,772 recoveries. That is up 24 since yesterday. When we look at our total cases, 2,389 female, 1,783 male, 441 under 19, 862 in their 20s, 540 in their 30s, 503 in their 40s, 611 in their 50s, 448 in their 60s, 322 in their 70s, 281 in their 80s, 164 in their 90s. Busy week last week, first week of back-to-school testing at MBT Bank Stadium. About 500 different tests were done. More demand than we thought. We're going to be scaling up right now the registration process that Upstate does. They're working on scaling up their ability, but we're also going to be scaling up our testing capacity there. We probably will be having both saliva tests and diagnostic tests there by the end of the week to scale up capacity to meet the demand. So we'll have more there, but just a reminder on how it currently works. If you are, your child comes back or you get the call from the nurse, child is sick, Monday through Friday, 9 to 1. The results of the test will be on an online portal. You need to schedule an appointment. And again, the call volume has been off the chart, so that's what's taking a little bit of a backup. But the phone number, 315-464-2582. You select option 4, and any child under 18 must be accompanied by an adult who can provide parental consent. That's for the saliva test. We probably will have at the same site diagnostic tests as well that may or may not need this type of process of pre-registration. We're working through that to meet the demand right now that we're seeing. The difference with that being that will be a nasal swab. So saliva test for some kids easier than a nasal swab, but we're looking at beefing up that infrastructure to meet the demand in the community right now moving forward. Saying that, that's our COVID-related update. I'll take questions.
On that exact topic, we have heard from people who are just waiting to get a call back to make an appointment. Are you surprised by the volume? Because these people are symptomatic of something. There's that many people showing symptoms.
I think right now what you see with back to school is it's an abundance of caution overall. So because of that, whether it's us doing our quarantines, probably quarantining more than necessary, but we want to learn from this, and we'd rather be cautious and conservative than the other way around. I think the same goes true for kids who are actually getting that phone call from the nurse. At some point, maybe those types of symptoms won't be receiving the type of phone call. But yeah, I mean, it's a lot of phone calls, Andrew, and you still can take your kid to go get a test anywhere else. You don't need to go to this site. You can go to the doctor, you can go to Syracuse Community Health Center, you can go to the other upstate site. So it doesn't mean this is the only site, but this is the saliva test site. And we know the saliva test is a little bit less intrusive for younger children. So at the same time we bring this online to meet the demand, the saliva test is being used about 100,000 times for the SUNY system as well. So it's going to be, hopefully by the end of the week, Upstate will have some of their systems updated to increase the saliva capacity, but we recognize that there's still people that are waiting or their appointments are a couple days later than where they would like them to be. So what we'll try to do is we'll try to get diagnostic testing on the same site. So if it's an issue of my kid has this one symptom and I don't have child care for him tomorrow or the day after that, go get a diagnostic test then. If you can't make the appointment via the Upstate line, boom. So we're working through it. But again, this is proactive things that we're doing that other communities aren't. So even though folks may be a little frustrated if you're in another county right now in New York State, you're on your own. Here, you're not.
Ryan, how long are people waiting for appointments at NBT?
To get appointments?
Yeah.
Jim, I want to know the answer to that. I know I get emails that's saying I called and I got an appointment a day later or 2 days later. When you have the demand there, that's what's going to happen for the saliva test. Again, that doesn't stop them from going to their own doctor or going to the community health center or going to the different Upstate site and getting a diagnostic swab. These are symptomatic cases, so insurance will cover them no matter where they go. But if you want the least intrusive test for children, this is it. So we're working on it.
So the diagnostic test they're going to be adding at NBT, what kind of test will that be? Will that be
same things? It will be a nasal swab, just like everywhere else.
Oh, it'll be nasal.
Yeah, but we'll be using most likely some of our rapid testing infrastructure that we've purchased for that, so that at least from a time standpoint, some of this is about timing, some of this is about preference and test for the kid. If your preference and test for the child is a saliva test, then being a day or two later probably is the best case scenario right now when we're receiving thousands of calls. If it's about timing, just to get the answer right away, we are recognizing that we have rapid testing infrastructure outside of upstate that we purchased. We're looking at getting that implemented for the site later in the week.
So the nasal rapid testing, how quickly will the results be available?
So assuming we get up to 22 samples a day, we can run the machine with 22 samples every 4 hours. So we have multiple machines, as do our partner there as well. So that is a true 4-hour rapid test. It can run every 4 hours. But that's a diagnostic test, right? That's a swab. So if you're a parent and it's about getting the results as fast as you can and getting them back so that your schedule and the child's schedule, they can get back into school, and they don't care about this nasal swab. And again, the nasal swab has been the way we've been doing this whole process, except for the last really month where we got the saliva test approved. Then that's going to be a good alternative, and we'll bring that to NBT Bank Stadium as well, most likely later this week.
Have you considered expanding any of this to asymptomatic people? I'm hearing that people are avoiding the health center because the turn times aren't as rapid as the back-to-school testing has been. I'm wondering if you've considered offering this to people who just want to test.
Somebody's got to pay for it. So asymptomatic testing right now, until we can work through some things, which we are trying to work through, that's not some of the things we were doing in the beginning. Insurance companies were covering. Now they're not. And so that's the challenge. So are we there yet? Not yet, Andrew, but we would like to be in a position where we can proactively test anybody, especially when you look at, usually you'll find if you do it in a surgical way and with some strategy, whether it's geography or age demographics, usually you'll find some little pockets that you can find, and that brings real value. So we're not quite there yet for the asymptomatic testing to the public. We're first working on finalizing asymptomatic screening in schools.
Regarding the party over the weekend, clearly there was 50+ people as far as the pictures are concerned. Is the county looking into this? I mean, we were told that the health department went there.
What party?
There was a big tent at an elementary school. I think it was Salem Hyde Elementary.
So whenever you're going to have a gathering, right? So the last thing we're going to put with a gathering is sending over an inspector who may be treated differently, put them in a position to fail. We use our inspectors from our standpoint when we're looking at, we know a business violated the rule. We then go give a notice, give a fine. If we think the business is going to do that again, we do it more strategically where we're not going to announce a visit, and then they go. We do commercial regulation in the county. When you're talking about a gathering where 100 people, 50 people, 200 people, law enforcement needs to handle that. They're the ones trained to deal with that. And so I believe the example you're talking about, law enforcement did go to. And I'm not sure what the final outcome was, if there was tickets or not. I read different things online about it. But that would be any type of mass gathering, the law enforcement agencies need to go deal with that. We can't have a random health inspector going there and trying to break up an event of a couple hundred people. It's just not the safe thing to do.
So the health department never went there?
A
health inspector never?
I would have to look into that. I don't know if a health inspector went. We never, those mass gatherings, we don't send out health inspectors to do law enforcement type behavior. Normally, I'll check to see if we had somebody there or not, but if we could have somebody going.
Do you think something needs to be done sooner when there's a big tent going up and chairs? And I mean, it was right along James Street. It was very clear. Do you think that, I mean, do you know if you got any calls or the police department? Or you?
Well, I think somebody from your outfit called us. so who works with you. So that we did not get any calls before then, and I got an email after then. And again, we don't have law enforcement jurisdiction in the city of Syracuse. The SPD doesn't report to me, and I believe SPD was called and they did go. I don't know the background on how somebody was on city property having a wedding, I believe it was. I mean, I have no clue on that background. That would be, I think, more of a situation that the city really needs to follow up on, and how somebody thought it was okay to go throw a wedding on public property. But we do commercial regulation. We aren't going to be sending out health inspectors to break up mass gatherings. That's not what they're trained for. I don't know if we did send somebody there. If somebody was out dealing with other businesses and maybe they stopped by there and they got a call, that could have happened. But on a situation like that, the law enforcement, whether it's your Syracuse Police Department, the sheriffs, the town or village police officers, when it comes to those types of gatherings, that's on them. They need to break those up, as the law is the law. Whether we agree with it or not, right now, that's the rule.
Did you watch the Syracuse football game on Saturday?
Did I watch it? I did watch it, yeah.
Okay.
Yeah.
I'm wondering if you'd give us some behind the scenes of how the county was involved in the testing that we heard about forcing the delay.
Yeah, so there was the Syracuse football team and all the athletics are doing really impressive protocols related to testing. ACC has adopted Syracuse's plan. So the athletes are tested 3 times a week. You're testing, as you know, you can test on a Wednesday, come back Thursday, come back Friday night, Friday morning, and the athletes are tested again on Friday. So in the situation related to Syracuse University, you had a potential false positive because it looked like it could have been a positive result on a Wednesday. That same person tested negative on Friday. And so out of an abundance of caution, we had a rapid test done before the game, and that person tested negative again.
This was an additional test.
Correct, Saturday. So you had 3 tests. You had a potential false positive in midweek. Friday's test, which was done less than 24 hours before that, you had a negative. And then out of an abundance of caution with our team, we recommended a rapid test, which Syracuse University has rapid testing equipment, and the individuals were tested again, and they tested negative.
Why so close to kickoff? Was it just waiting for those rapid results to come in, and it just got that close?
Yeah, I think think about the timing of this, right? The athletes are being tested. The visiting athlete is tested before they get on a plane. And then they're tested again when they get here. So those tests go out and they got to come back. That was Friday because Georgia Tech wasn't even here for 24 hours. Syracuse, same thing. I think they get tested on Friday before a game. Game's at noon, not a lot of turn time. So the Wednesday results, is my understanding, came back late Friday night. Early, so you got Wednesday's results, and then you have Friday's results that come in Saturday morning. You see a potential false positive there, and so then we went and got an additional test.
Wow. Do you have county leadership there on site with them in these critical running out of time moments?
This game we did, and we were all involved with the decision making on how that needed to play.
So you're
out.
literally on the phone with health leaders moments before the kickoff of the football game.
Correct.
Not really how you used to enjoy games, I imagine.
Everybody got to see a good win, so it worked out well.
Was it 3 people involved in this?
I don't know if it was 2 or 3. I think there was maybe 2.
And it was players.
I don't know if it was a coach or players or what. It was at least the concept is, for us, it didn't matter. It's part of the testing protocol, people that have exposure to each other. So I don't know specifics on what it was, who it was. I know people that need to get tested. There was, essentially a potential false positive that we need to make sure it was a false positive, and we did.
What flags it as a false positive, where you didn't consider it a positive and you put these people in quarantine right away?
The fact that we got the results back basically at the same time and the results were conflicting.
Okay. if there had been a positive, is that one person removed, or would they call off the game that close to kickoff?
I don't want to talk about hypotheticals, Andrew, but it's highly likely if you had a positive that close to a game, that game may not have happened. But again, the Dr. Gupta makes that call, not yours truly.
I'm curious what health department level of employment are there, on who gets the assignment to go to the games in the health department?
I'm not going to go into that, who that is. But Dr. Gupta, Ann Rooney, and myself were all working with Syracuse officials between 11:45 and 12:45.
Last question on this. Is that a stressful moment? You're about to kick off a big football game, the debut of the Carrier Dome or whatever it's called this week. What's it like to be on the phone with your health commissioner talking about player testing minutes before a kickoff?
Just another chapter in the book.
Ryan.
Last week, one of the tenants over at Shoppingtown received something from Moonbeam. I just wanted to kind of get an idea of, they're still in the middle of bankruptcy hearing out in Pennsylvania, yes?
Correct.
Do they have the right to do this while they're in the middle of a bankruptcy hearing?
I don't believe so. I don't think that's going to stop them from doing what they're doing. Mind you, Moonbeam they can't open up anyways. They've never made the upgrades to their filtration systems that are necessary. Or if they have, they haven't alerted us to inspect them. But certainly it's contradictory to what they're telling the bankruptcy court. They're telling the bankruptcy court, our debt is so much, or our creditors are so much, that we need relief to make this a viable property so that we can have success. And that's what bankruptcy court's about, right? You try to restructure your liabilities. Now, when we're the only liability, tough to restructure us, right? It's a tough argument, being the taxpayers of Onondaga County. So that was their argument. So for them to kick out their revenue, their only revenue, usually you want to get your debt load lower, not eliminate your only revenue. So certainly very odd. We've alerted the bankruptcy court. We've passed on the fact that these individuals have gotten these eviction notices to the proper authorities as well for them to make the proper determinations on legality.
Changing topics again, we went through the first round of furloughs. Where do we stand as far as a next round of layoffs or furloughs coming up?
Yeah, so we have, it's not this week, but next week, I believe we have 2 sales tax payments, and so that's going to determine a lot. So our hope is that we've seen small progress with each payment. We're still losing money, but not at the rate that we once were. So our hope is that is what happens again, and that we don't have to make any adjustments, in October. But again, that's somewhat out of our control, as is the reality that the state of New York is threatening to cut us $20 million. They're withholding us essentially that money now. They haven't officially cut us, and we're still waiting to see if anything happens in Washington.
Yeah, thanks.
Ryan, do you have ages for the 2 individuals who passed away over the weekend?
Yeah, I think, Jim, if I recall, one was, I believe, 88, and one, I believe, was 95.
And then on the NBT issue, the saliva swab test, is the turnaround time still, is it 24 to 36
Correct.
hours?
Yeah, the turnaround time on the actual processing of it is that. I think what some people get confused about, at least through some of the communication with us, is they're not getting in to get a test in 24 hours. But the turnaround on the test is still 24 to 36. And so we're trying to streamline it. Certainly, I mean, we had over 500 kids and faculty that we tested last week. And I think we're going to get the same number this week. And so we want to expand capacity there every way we can to meet the need. But they do have those other options. These are symptomatic children. Your insurance will cover it, so they can go to any of these other sites as well.
Now, I know last Monday through Wednesday, you reported that there were no positives.
Right.
How about on Thursday and Friday?
We did get some positives on Thursday and Friday.
Do you know how many?
I think it was somewhere from 5 to 7, I believe. I got to
5 to
confirm
7.
that. But we did receive positives. Some of those positives have been reported in the media. Obviously, we have cases in schools. We had cases in schools. We never had cases in schools before because they weren't in school. But we had people in this profession over the summer and over time period getting COVID. And we had students who just weren't in school getting COVID too. And so that's, you know, to Dr. Gupta's point that she's brought up, this is going to happen. The virus is here. We're doing things to make it as safe as we can for school to happen. If you look at everything from a macro level, we've had a pretty good opening. Really only one, if you look at all the cases we've had, there's really only been one cluster of cases related to some employees being together that led to cases. It's, you know, it's so far so good. It's tough when you're talking about your kids. And so that's, you know, that's always going to be tough. But again, we had middle school kids, we had high school kids, we had very few younger kids becoming positive throughout the pandemic. But we've had teachers and administrators get this. Now they're just back in buildings, and some of these kids that were getting it are remote learning too. And so the impact for contact tracing and whatnot hasn't been as challenging. But there's been a couple, you know, challenging contact tracing cases that we've had. Some have been very easy, some have been more challenging. Other questions? Anything else? No? Okay. Then we will see everybody again